Okay, today we have Victor here, who recently came into our office with acute knee pain. Victor, on a scale from 0 to 10, can you just tell me what the level of pain is that you're having?
Right now?
Yes.
I don't know, about 6.
It's about 6 on a 10 scale. And you can just try to do a squat as best you can. Show me what the range of motion you have. And that's about it. Okay, you can go ahead and come back up. Okay. All right. Good. Thank you. Okay, this is the second day treatment with Victor. This is the second visit for PEMF for 30 minutes in a unique procedure known as Trigenics, which has allowed the knee to unlock and has improved Victor's range of motion and the reduction of his pain. Victor, how do you feel now? How much improvement would you say you feel?
Well, yesterday I'd say about 50%.
50% better?
Yeah.
Show me how much range you have. Okay, that's good. And let me see, bend the knee up like you did before. And you said you definitely could not do that yesterday.
I couldn't do that yesterday, no.
Okay. All right, great. Okay. Think we're helping you?
Yeah.
Okay. All right, Victor, thank you. Walk towards me. Okay, stop. Then just tell me your name.
My name is Chen.
Okay. And how long have you had this condition?
2 years.
3 years? 2 years?
2 years.
2 years. And nobody was able to determine why you have it. They told you had Parkinson's.
They not told me get Parkinson's.
Okay. And they put you on what medication? Got it. Okay.
I will give you that medicine. Take a look.
Okay. Okay, this is Jimmy. This is approximately an hour and a half after he just had a 1 hour PEMF session with the Pulse Center's X1 device. He did a full body charge for 50 minutes and a 10-minute charge on the head with the paddles. Jimmy, can you tell me how you feel?
I feel comfortable right now. So,
Comfortable?
yeah.
And
I'm not shaking my head and I feel my body easy to move.
all right, so percent better. How do you feel?
Feel much better.
Okay. All right. Good. All right. And did it hurt? The treatment hurt? Was it
No.
comfortable?
No, it's comfortable. Very
comfortable?
comfortable. Yeah.
Okay. All right. Thank you, Jimmy.
Thank you.
Hello, everybody. I'm here today with Amy, who came into our office because she was suffering with
knee issues, a patella that didn't want to stay in place.
Okay, so that was very painful, and can you describe how that was affecting your life?
It felt like a lot of pressure, like a balloon in your knee, and it wasn't as stabbing painful as it was just trying to move your whole knee, bend it, whichever, it didn't really want to go. So I came to Dr. Petrie to actually start with some chiropractic care on it, but he introduced me to this Pulse program for pain management slash, well, it was all new to me, so
Okay.
I have walked through it with him now on 4 occasions, and my knee is much better than it was when I first came in. The swelling has gone down. The mobility factor is better. And one story I told Dr. Petrie was that I live in a beach community, so going up and down the stairs to the beach from, say, the parking area, by the end of the day, walking on the sand, etc., felt like your knee was the size of a watermelon. And just after these practices with this program, it's so much easier to go up and down those stairs.
Okay. What's it like to have the treatment? Is it comfortable?
It's very comfortable. It's when you do the full body, the chair is very comfortable. You can relax. It doesn't feel like anything that hurts. It's relaxing. You're in an environment here which is definitely relaxing. Lights on or lights off. The feeling from the pulse is not painful. or anything. It's a very like subtle feeling, and when you get after 3 visits, I definitely felt better, which is now why I'm continuing on for more visits.
Okay, thank you, Amy.
Thank you.
Hi, could you tell me your name, please?
Sure, my name is Mike.
And Mike, what was it that brought you to our office?
I was involved in a low-speed, low-impact auto accident. Received, several bangs and injuries, caused from that. Went through about 6 weeks of physical therapy, and physical therapy wasn't doing anything for me. It was making, it was aggravating the muscles, and I was recommended by a co-worker to come see Dr. Petrie, and after the first treatment I felt 15 years younger.
Okay.
Wish I had done it 3 months prior.
Okay. And how do you think this will affect you in the future?
Oh, I think it's fantastic. I mean, I plan on coming back to Dr. Petrie, for the rest of my life. Just for the feeling that the energy's back in your arms and your body, and definitely, don't feel like an old man anymore. I feel younger again.
Okay, great. Thanks, Mike.
All right. Thank you.
Hello, can you tell me your name, please?
Hello, my name is Tammy.
Tammy, how long have you been coming to this office?
Just about 7 years now.
Can you tell us what brought you here in the first place?
Yes, I was recommended by a friend because I have a history of headaches that are a little bit odd. They almost stem from the back of my neck and radiate over my head to my forehead and temples.
And how has that affected your life when you were having these headaches?
It's horrible. It's very depressing. It really ruins everything 'cause there's no pain medication that will take care of it. It's a nerve problem. It's not anything that can be relieved by pain medication. So the quality of life is pretty low.
Okay. And what has happened since you started chiropractic treatment?
In the beginning, it turned out that episodes of having this were definitely decreased. So it was almost like if I had it 3 times a year, I was down to 1 time a year. And the frequency and intensity was much less.
Okay. And can you imagine what would your life be like without any headaches?
Since I've been without headaches for over 2 years now, coming to your office regularly, I don't even remember the last time I had an episode of the headache, my version of the headache. So I think it's been almost 2.5 years now. Like I said, so I come because I feel so good.
Okay. Thank you, Tammy.
You're very welcome.